Hi, good morning Ruben. My name is Mihiraa. I'm your invigilator for the OET-speaking session on the 6th of July 2022. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Ruben Philip.
And what is your candidate number, please?
My candidate number is 260342119.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
Thank you. So let's start with warm-up questions. The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
That's all right.
What do you think of your earlier boss?
My previous boss, at the hospital where I worked, trained me on the importance of work and time management, which is my priority as a nurse. He was extraordinarily driven, and wouldn't take excuses if the job was not correctly done on time.
How do you react in stressful situations?
The most important thing to do in a stressful situation is not to become nervous and react inappropriately. At this point in time, the best approach is to not think about demands too much. Instead, keep doing tasks one by one, as fast as you can. I try to remind myself about how central my job is, and continue with my work with a positive attitude.
Name some skills that are mandatory for a nurse in order to be successful in the career.
Apart from technical skills, a nurse needs some special soft skills, which are teamwork, communication, listening and understanding skills, empathy, organizational skills, patience and hard work, etc.
Where do you see yourself in the next upcoming years professionally?
I believe with my dedication towards my job, in the next upcoming years, I will see myself as a professionally successful nurse. I would like to see myself in administration, or another senior position in this hospital.
How do you use organizational skills in your daily responsibilities as a nurse?
Being a nurse, I'm enrolled with various responsibilities, and my job demands to be organized. To keep a tab on all duties, I create a checklist for things to do, and tick them off, as I complete the task accordingly. The tools that I need to handle, I keep them organized as well, so that I can carry them easily when I need them.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when the 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role-playing card if you want to. Here's a pencil for making notes.
Thank you.
Your preparation time is over. You can now start your OET-speaking role-play. Don't worry if I stop you when the time is up.
Mihiraa, I have completed Felix's clinical observations. From my observations, he is doing well. Nothing to be worried about. There is no cause for any concern at the moment. Currently, his condition is stable. How do you feel about that?
That is something good to hear. Perhaps, nurse, the whole process has been upsetting. I am just worried about my son.
Mihiraa, I can understand your worries. Felix's condition is quite satisfactory, and I can assure you that he will be all right. Look at him, he is quite comfortable, and is not in pain anymore.
Yes, what you have said is correct. But nurse, I find it very scary, seeing him attached to lots of tubes and machines.
I take your point. It is natural for a mother would feel difficulty seeing her son attached to tubes and machines. For time being, these are necessary for Felix, and I can explain the purpose of your son's intravenous line and tube, so that you will feel much okay.
All right, nurse.
Mihiraa, the main purpose of the intravenous line is to serve adequate fluids to Felix, in order to prevent dehydration. And, it is through these tubes, his antibiotics are being administered.
Okay, I got it.
The other tube he is fitted with is a nasogastric tube. The need for a nasogastric tube is very much important for Felix's condition. This tube is used to remove his stomach contents, so as to relieve the pressure on his stomach that is acting against his condition. I hope your concerns regarding the use of the tubes are clear, and you feel relaxed now. Isn't it, Mihiraa?
Yes, nurse. I feel better now that I understand why he needs the IV line and nasogastric tube. However, I want to be sure that the nurses are going to check on him often, in case anything changes.
Your concern is reasonable. Mihiraa, we will be doing regular monitoring without failure. There are several reasons for regular monitoring. The primary purpose of regular monitoring is to do clinical observations and to make note of his vital parameters. Alongside this, we will be checking for any pain or discomfort he is experiencing. Thus, we ensure your son is doing well and stable.
All right.
Other than that, I can confirm that there are no changes happening in his treatment procedures. Mihiraa, your son Felix's treatment will start soon. Initially, he will be transferred to the X-ray department. After getting the X-ray report, his procedure will be commenced by the medical team. Completion of the procedure will bring him back to the ward for further monitoring.
All right, nurse. Thank you for the clarification. Well, nurse, the doctor said I can't stay with my son during the procedure, but I think I should be allowed to stay with him because he's so young.
Your thoughts are natural, Mihiraa. I am sorry to say that parents cannot stay with their child for a procedure. The X-ray environment is not suitable for the body, but is inevitable for the diagnosis. In addition, before the procedure, your son will be sedated and will not be aware of things happening around. Mihiraa, don't be bothered too much. Felix is undergoing a small procedure, which only lasts for a short period of time. And from time to time, we will keep you informed.
All right. I understand now. I will just sit with my son until he goes for the treatment.
Sure, Mihiraa. I reassure you that he will be all right, and the procedure will be completed in a short time. He will be back to you soon. Always feel free to contact us for further queries.
Sure. That is the end of your OET-speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.